Hi, my name is Shelby Lopez. I'm currently a student at Eastern Kentucky University, and I am pursuing a degree to become a psychiatric mental health nurse practitioner. In today's presentation, I will be talking about the implementation of mass media and its use to help reduce negative stigma associated with behavioral health diagnosis. So, background and significance of this is according to the World Health Organization, there is regional, national, and universal needs for those at risk with mental health service. Also, emphasis directed at leadership and governance of mental health, provision of mental health and social care services in community settings, and strategies of promotion and prevention with evidence-based research are value components of behavioral health. The PICO used for this presentation is in patients with a newly diagnosed mental health disorder. And that would be any age, so adolescent, child, adult, or senior adult. How does mass media, and that's going to encompass social media, podcast, television, TED Talks, live streaming, seminars, conventions, and literature, compared to no mass media, affect the reduction of mental health stigma, and the time frame being used is a 6-month frame. So just on a personal note, the reason why I was intrigued by the incorporation of mass media is, currently with the pandemic, you're constantly hearing different advertisements and information on the radio, on TV, even walking into stores or pharmacies. And I was just curious to know if this information, that the public is hearing is it useful information? Are they soaking it in? Are they applying it to their daily lives? And I wanted to, kind of parallel that with behavioral health. So how can we benefit from that as well? And that's kind of where the start of my idea for this implementation began. So there were 3 different pieces of literature used to help support this research implementation. The first was a level 1 evidence, and that was written by Gaw et al., and that was published in 2021. So they did a systematic review and meta-analysis, and their findings concluded that online anti-stigma interventions are as successful in the reduction of psychiatric mental health conditions as face-to-face interventions. So mass media is beneficial. They found that, and as beneficial as actually meeting, one-on-one or face-to-face with someone, which was really interesting information. And then for the level 2 evidence, this was written from Zimbris et al., and that was published in 2019. They conducted a randomized controlled trial, and this trial, they were trying to determine if mass media interventions, as opposed to a standard public health message, were more beneficial and the reduction of negative feelings associated with schizophrenia. And again, this study did indicate that mass media plays a very important role in mental health literacy and the way that information is presented as well as perceived. And then in the last article that was used to help with the supporting of this implementation of research was a qualitative research article that was written from Coe and Shrimpton, and it was published in 2013. So this article, or this research information, utilized different artists, and they had a kind of like live seminar that was open to the public. And these artists had previous diagnosis of mental health disorders. So they had their actual artwork that they created on display for the public to come and view, and then attached to it was kind of a summary of what their diagnosis was, and then how it's affected their life, and also what they're still able to do. So this was a way for the community to kind of gather information and just promote health literacy and awareness that even if you are diagnosed with a mental health disorder, you can still enjoy things and have hobbies and interact with one another. So those were the 3 articles that were utilized. in this research presentation. So for the theoretical framework that was utilized, this was Kristen Swanson's theory of caring, and it was originally published in 1991. So this theory has 5 sequential steps. Those steps are maintaining belief, knowing, being with, doing for, and the last step is enabling. And then her theory states that by following these sequential steps, that you are helping to promote dignity, care, and empowerment to increase patient satisfaction. So with this implementation, the patients themselves are going to have the ability to pick what form of mass media they're going to use. So I thought that was a perfect example of enabling patients to be in control and having complete autonomy, in their care. And then as the practitioner, you're also being with, and then you're also knowing, and you're maintaining belief that the patients are going to follow through with this and that they're also going to benefit from it. So I thought this was a perfect theoretical framework to use with this implementation of research plan. So for the implementation of the research, the practitioner or organization's goal is to recruit 100 active participants in this study. So these are participants that are, consistent, that they're not ones that are going to drop out. We're going to have 100 current active participants. So these participants have to be newly diagnosed with a mental health disorder. And the reason why this is because we want to test their baseline knowledge of their initial behavioral health diagnosis. So once these patients have agreed to the study and then they're candidates for the study, an initial baseline assessment will be conducted. So this is to kind of test their knowledge, to test if there are any negative, stigmas associated to their new diagnosis. And then most importantly at this time, the practitioner is going to offer, mass media for the patient to choose. And then they will return to the office within 2 months to see if there was any health literacy gained to help reduce any negative stigma associated with their new disorder. So this will be done a total of 3 times. The patients are to return every 2 months, so it'll be over a 6-month time frame. And then again, at the end of the year, so 12 months after they've been diagnosed, a final long-term assessment final assessment will be conducted to test the long-term knowledge gained from the different mass media sources to see if they truly are beneficial, and if the patients are able to retain the information from these sources. And at each follow-up 2-month appointment, a different form of mass media will be chosen. And the important thing with this is I think that patients should be able to choose what form of mass media they're wanting to implement and they're wanting to use. So that's going to be up to the patient to decide, but a different form at each visit will be chosen. And again, those different forms for the patients to choose from could be social media, podcasts, television, TED Talks, conventions, seminars, literature, things of that nature. And then for outcome measures, again, there was the baseline assessment with a specified screening tool specifically for that diagnosis. So an example of this is if a patient is presenting with alcohol use disorder, there are 2 different baseline assessments that could be used in this instance. One is a CAGE screening tool, and that's CAGE. Another is the AUDIT-C, which is AUDIT-C. We just want to make sure that whatever the diagnosis is, the appropriate screening tool is used. So it's not going to be a generalized screening tool. But that same screening tool will be used each time at the 2-month follow-up appointments. The reason for that is we want basic information and we want to test the knowledge from previous appointments. So different questions or, different topics related to their diagnosis might be skewed or might be different, and it could affect the analysis. So we wanted to make sure it's the same test each time. And then again, the time frame utilized for this, we have 100 participants, and for each participant, they're going to come every 2 months for a follow-up appointment over 6 months, and then one final assessment to analyze the data at the 12-month mark to test the long-term knowledge gained. And then after this, the information and data analysis will be disseminated within the organization, local stakeholders, and then to see how the information gained can positively affect and help to educate and be useful in the local community setting. So I think that pretty much sums up the presentations that I had to share today with mass media and its use to help reduce mental health stigma. I thank you for your time. I hope you enjoyed the presentation, and thank you again.